And the high cost of health care continues to be a heavy burden for many families locally. Research from 2019 shows that at least 60% of Chapter 7 and Chapter 13 bankruptcy filings in Oregon involved medical debt.
And that's why a national movement called RIP Medical Debt is putting the spotlight on the Beaver State. Joining us live to tell us about their fundraising push to help Oregonians is Scott G. Patton with RIP Medical Debt. Good morning.
Hi, Emily. Hi, Ken. How's it going?
Good,
Going
good.
well.
You know, this is an issue that so many families struggle with and just feel crushed under medical bills. So tell us a little bit about RIP Medical Debt, how this organization works, and how it gets rid of some of this debt.
Sure. Well, we hope to be a source of justice dealing with a very unjust medical billing system here in the United States. As you cited, 60% of bankruptcies in the United States are due to medical debt to some extent or another, and that's not even including the people who can't afford that can't afford bankruptcy proceedings. So it affects a lot of people, and it doesn't matter if you have insurance or not. Everyone is potentially a victim of medical debt. So we actually buy or receive donations of medical debt directly from care providers or the secondary debt market in large bundles. We qualify that debt to make sure that we are acquiring the debt for people who most need the relief, if they are earning at or below 200% of the federal poverty limit, or if they are paying 5% or more of their income to these medical debts. We relieve thousands and thousands of accounts all at once.
Okay, so you acquire the medical debt, and then what happens at that point?
Sure. So once we acquire the medical debt, we do not collect it, right? We never have collection activities. We send out letters to all of the individuals in those portfolios that we've purchased and let them know exactly which accounts and from which care providers, including the dates of service of the accounts that we purchased that are relieved, and that they are under no obligation to pay them now or forever. So we send out lots of letters every year, and we hope to make quite an impact in Oregon here in the next couple months.
Yeah, let's talk a little bit about that campaign. You have a goal here of raising $14 million. And it's interesting because $1 donated does not just equal $1 of medical debt wiped out. Your money can really go far through the way that you purchase this debt.
Well, right, and it's actually even easier. We're not trying to raise $14 million. We're trying to raise $140,000
Oh, okay.
in order to, because of that return on investment, that 100-to-1 ratio, we'll be able to abolish between 10 and $14 million of medical debt with raising 100 to 140,000. So the impact is really significant, and it's going to touch about 20,000 individuals and Oregonians. Of course, many of those people also have families, and they'll be able to afford other things and shift their focus away from the burden of medical debt and hopefully experience a lighter day.
Yeah, you alluded to this earlier in this interview, but how crushing can medical debt be for families, and how does it really impact them? And did you notice any changes during the pandemic?
Sure. So during the pandemic, we've definitely seen a spike in hospitalizations. Now, I'm not really an expert in patient care revenue cycles. I think we'd have to ask someone from a hospital how that has affected overall medical debt across the country. But what we do know is that there's more hospitalizations and there's potentially, more problems with medical debt. So we're doing everything we can to shore that up. And yeah.
So we're working to raise $140,000 here then for Oregonians. How can people donate and be a part of this effort?
They can contact RIP Medical Debt through our website, or they can visit that campaign page that is at ripmedicaldebt.org/Oregon. Find us on that campaign page and make a donation through that website. We will be, of course, following up with all of our donors once we finish this project and letting everyone know exactly where the debt was purchased in the county array of the state of Oregon, the average amount relieved for each person, and the overall impact the campaign had for the state.
Oh, that's fantastic. I mean, to have a campaign specifically for the state, so the money you're donating is going to help other Oregonians. It's not just going into the pile. This is an option to make an impact for your neighbors. Scott G. Brown with RIP Medical Debt, thank you so much for joining us. Good to talk with you.
Thank you.
And to help Oregon families clear some of their medical debt, you can donate right now on ripmedicaldebt.org.